Urologist, 2 masturbation mistakes after 60 that are silently harming older men, advice for elderly. Aging is a natural journey, one that brings wisdom, memories, and a sense of perspective that the younger years often lack. But as men cross into their 60s and beyond, the body begins to whisper subtle warnings that cannot be ignored. One area that is rarely spoken about openly, but silently affects millions of older men, is sexual health. Many elderly men continue the practice of self-pleasure, often in secrecy, sometimes in shame, but almost always without proper guidance. The truth is, masturbation itself is not harmful. In fact, in moderation and with mindfulness, it can even promote prostate health, relieve stress, and help maintain sexual function. But here is where the real problem begins. After 60, the male body does not respond the same way it did at 20, 30, or even 50. The prostate enlarges, testosterone levels decline, blood flow to the genital area slows, and recovery time lengthens. What was once harmless can now quietly turn into a health trap if certain mistakes are repeated. Urologists have long pointed out that while masturbation isn't inherently dangerous, 2 common mistakes made by older men can silently harm their bodies, shorten their vitality, and even affect their lifespan. And the tragedy? Most men never realize it until the damage is already done. Let's uncover these mistakes one by one, and more importantly, understand how to avoid them so that intimacy, even with yourself, remains a source of strength, not suffering. Mistake number 1: overstimulation and excessive frequency. When a man is young, the body is like a fresh engine. It can handle repeated strain and recover quickly. But after 60, the engine has wear and tear, and pushing it beyond limits leads to hidden problems. Many older men, often dealing with loneliness, anxiety, or boredom, turn to masturbation as a frequent escape. Some do it daily, sometimes multiple times a day, without realizing that their body no longer has the same hormonal and vascular resilience. Why is this harmful? 1. Prostate overload. The prostate gland produces semen. With aging, the prostate naturally enlarges, a condition known as BPH, benign prostatic hyperplasia. Overstimulation through frequent ejaculation can strain the prostate, leading to inflammation, discomfort, and even increased risk of urinary problems. Some urologists warn that excessive frequency after 60 can worsen symptoms like weak urine flow, dribbling, and frequent nighttime urination. 2. Hormonal drain. Every ejaculation uses up small amounts of testosterone, dopamine, and zinc. In younger men, this is quickly replenished. But in older men who already suffer from age-related testosterone decline, frequent release can deepen fatigue, lower muscle strength, and reduce vitality. Over time, it may even accelerate sexual burnout, leaving men weaker instead of satisfied. 3. Cardiovascular stress. Masturbation increases heart rate and blood pressure temporarily. For a man in his 60s with hidden heart disease or vascular stiffness, repeated strain can trigger fatigue, dizziness, or in extreme cases, even cardiac complications. 4. Mental toll. Ironically, while men masturbate to relieve stress, excessive dependence often leads to guilt, emptiness, and even depression, especially if it replaces real emotional intimacy. The urologist's advice: for men over 60, moderation is the golden rule. Limit self-pleasure to once or twice a week, focusing on quality, not frequency. Treat it as a mindful act of intimacy with yourself, not a mindless habit born of boredom. Mistake number 2: using aggressive techniques and ignoring the aging body. The second mistake is less obvious but far more damaging. Many elderly men continue to use the same aggressive, rough methods they used in their youth: tight grips, intense friction, rushed release, without realizing that the aging body is more fragile. Why is this harmful? 1. Penile sensitivity loss. Over time, aggressive masturbation causes what urologists call death grip syndrome. The nerves of the penis become desensitized due to excessive pressure and friction. Older men often then find it harder to achieve pleasure with a partner, leading to frustration, erectile dysfunction, and a sense of inadequacy. 2. Vascular damage. The penis depends on healthy blood flow. Rough handling can damage delicate blood vessels, leading to microtears, scarring, or even Peyronie's disease, curvature of the penis due to scar tissue. For a man in his 60s with already reduced circulation, this damage can be permanent. 3. Prolonged recovery time. Younger men may recover in hours, but older men may take days to restore normal sensitivity, testosterone balance, and energy. Aggressive habits only extend this recovery, leaving them chronically tired and irritable. 4. Prostate backflow. Sometimes, rushed or forced ejaculation can push semen backward into the bladder instead of outward, a condition called retrograde ejaculation. While not dangerous itself, it signals weakening of the sphincter muscles and can affect urinary health. The urologist's advice: be gentle and patient with your body. Use lubrication to reduce friction and avoid tissue damage. Slow down. Savor the experience rather than chasing a quick release. Experiment with different methods that focus on arousal, touch, and relaxation instead of only tight, rushed stroking. Remember, after 60, quality of sensation matters more than intensity. The hidden truth few talk about. The saddest part is that most elderly men suffer in silence. They rarely discuss sexual habits with their doctors, fearing judgment or embarrassment. Yet, ignoring this topic leads to decades of avoidable suffering, urinary problems, prostate issues, weak erections, and emotional loneliness. Urologists insist that self-pleasure is not a sin, not a weakness, and not a shameful act. But like everything in life, it requires wisdom, balance, and respect for the body's limits. At 60 and beyond, the question is not, should I stop? The real question is, am I doing it in a way that nourishes me or slowly destroys me? How to masturbate safely after 60. A urologist's guide. 1. Frequency: once or twice a week is ideal. Listen to your body's recovery signals. 2. Use lubrication. Protect delicate skin and blood vessels. 3. Mindful breathing. Combine slow breathing with arousal to reduce heart strain. 4. Stay hydrated. Prostate fluid production depends on hydration. 5. Exercise. Regular pelvic floor, Kegel, exercises support stronger erections and bladder control. 6. Communicate with doctor. Don't be ashamed. Ask your urologist about safe practices, especially if you have prostate issues, diabetes, or heart disease. A final reflection. Life after 60 is not an ending. It is a second chapter. Intimacy does not disappear, it transforms. What was once about release and urgency becomes about gentleness, awareness, and connection with yourself and with others. Masturbation, when done mindfully, can be a friend to the aging man. But when abused through overstimulation and aggressive techniques, it becomes a hidden enemy, silently draining strength, harming the prostate, and leaving behind emptiness instead of fulfillment. The wisdom of aging is simple. Treat your body as an old friend, not a machine to be exploited. If you are over 60, remember this truth. Pleasure should restore you, not exhaust you. White heavy checkmark in summary. The 2 mistakes older men must avoid are: 1. Overstimulation/excessive frequency, draining hormones, harming prostate, exhausting energy. 2. Aggressive techniques, nerve desensitization, vascular damage, prolonged recovery. With balance, patience, and self-respect, even in the later years, a man can enjoy not just longer life, but a healthier, fuller, more meaningful one. Hit that subscribe button and join us on a journey through the timeless wisdom of the older generation. Don't miss a single life-changing lesson.